In an STD surveillance, CDC revealed that as per 2021, more than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported. With me today is Kate, a student from the University of Nairobi studying pharmacy. Hello, Kate.
Hello.
Welcome to the show.
Thank you. So, Kate, how are you?
I'm fine.
Kindly introduce yourself to the viewers.
My name is Kate Owino, a second year student pursuing pharmacy at the University of Nairobi.
Thank you, Kate. What is the difference between an STD and an STI?
So an STD stands for a sexually transmitted disease, and an STI is a sexually transmitted infection. So an STD stems from an infection. So an STD is comes in when the infection gets worse. That's when you're now told you have a sexually transmitted disease. But an infection, it's kind of less severe than the disease. Yeah.
Okay, thank you. And is it true that some STDs show no symptoms at all?
Well, yeah, actually, there are some which show no symptoms, chlamydia, genital herpes, but most of the times for males, males are most likely to show no symptoms for most STDs.
Why is that?
It's because for females, their vaginal area has a larger surface area as compared to the males, whereby mostly it's the skin of their penis which is exposed.
Thank you. Is it true that I've been hearing this rumor and seeing it on memes where people are saying that you can get an STD by sharing lip gloss? How true is that?
That is it's a rumor. It's not 100% true, because most STDs are spread through body fluids. That is semen, vaginal discharge, blood. So for lip gloss, that will only happen when you have a wound in your oral cavity, which also most likely only accounts for a very small percentage of infection. So it's not as risky as people would think it is.
Yeah. And when testing for an STD, what is the protocol? Are students required to come with their partners, and what is the implication of not coming with your partner?
So it is only necessary for some STDs for you to go to the clinic with your partner. Like chlamydia, it is necessary. Like when you go and you're tested and it is confirmed that you have it, they'll require you to go and get the person you are sexually involved with, because that is chlamydia is very dangerous. So they require to treat both partners to curb its infectious nature, because it is very easily spread and it is dangerous at the same time. But there are some which you can be treated on your own without having your partner coming with you.
Again, most times do students come with their partners, really?
No, not really, because it's maybe in cases like chlamydia, which I mentioned, that is when it is really required, that is when they go. But you see, for some, it's because of the shame that comes with it. Maybe they want to hide, so they don't normally go with their partners to the clinic for testing.
And I think that is very detrimental.
Yeah, it is very dangerous, because that's going with your partner helps to curb the infection, to curb the spread of the infection. Because if you know and your partner doesn't know and they go and have sexual relations with another person, that will help to transmit the disease more.
So, Kate, what is the difference between the PEP and the PrEP? That is the post-exposure prophylaxis and the pre-exposure prophylaxis.
So for the difference between PrEP and PEP, of course, PEP is it is a post-exposure prophylaxis. PrEP is a pre-exposure prophylaxis. So for PrEP, it is when you are most likely at risk of maybe you're going to maybe you're a very sexually active person, so it is given before like you get exposed to a situation where you're most likely to get infected, while for PEP it is given after maybe you've had an encounter which puts you at risk to getting infected with HIV, such as rape, yeah, or maybe in your sexual relations, a mistake went wrong, like the condom burst. Yeah.
And what is the procedure of administering PEP to a student who has been exposed at the school clinic?
So at the school clinic, first when you go to the clinic, they first assess the risk of you getting infected. So for like 48 hours, they'll give you medicines, they'll give you tablets, something to take for like the next 28 days. That is to, if you are at risk of getting infected, that helps to keep the HIV cells count low so that it doesn't spread in your body. So, and you're normally required to go to the hospital frequently to be cancelled and to be checked on regularly within the 28 days.
What is your takeaway on couples who are dating in campus?
So for those dating in campus and they are sexually involved, it is recommended that they protect themselves. They use protection. It is also advised that every once in a while they go get tested together, so that in case they have an infection, the doctors are able to treat it earlier enough. But the best measure would be to abstain, which kind of seems tricky for students in campus, but that will be the best measure to take because it helps a lot. It is better than even treating the infection at start. Yeah.
Thank you so much, Kate, for this informative conversation. And as you've heard it from Kate, a fellow student at the University of Nairobi, this brings us to the end of the show. Thank you so much for staying tuned in. Catch us next time on the next episode. I have been your host, Kiberenge Maria Jones. Let's meet next time, same time, same place. Have a lovely week ahead.